Let's go back. And you want to do another one? Here, do two more.
Okay.
Okay, let's go.
All right. What is the primary physiologic problem?
Okay, so this wants to know what kind of problem it is. Let's go.
All right. A 74-year-old male complains of weakness and near syncope.
Okay, near syncope means they kind of passed out. Syncope is where there's an interruption in blood flow. So syncope is a brain problem where there's an interruption in blood flow. And if there's an interruption in blood flow, what kind of problem is that?
Perfusion.
Okay, so blood flow is probably a perfusion problem. Let's see if we can find some more evidence for a perfusion problem. Let's go.
He is pale and diaphoretic.
Oh, that's sounding like perfusion. Keep going.
His blood pressure is 78/42.
Hypotensive, okay.
His heart rate is 38.
What do you call that?
Bradycardia.
All right, so we've got,
okay,
we got bradycardia. Keep going.
Yep. And regular.
Okay.
Respiratory rate is 20 and SpO2 is 96%.
All right, tell me about this respiratory rate. Is that okay or not?
That's okay.
It's the upper limit of normal. Normal for an adult will be 12 to 20. This is at 20. So, I mean, it's at the upper limit of normal, but it's not, that by itself is not what's concerning me most. What about this pulse ox?
It's normal.
Okay, we're going to say that's normal. It falls within the 94 to 99. We're going to go with that. Tell me about the lung sounds.
They are clear.
All right, lung sounds are clear. When do we check lung sounds on which patients again?
All of them.
All patients with lungs, okay? Now, what's the main problem here? Oxygenation, ventilation, or perfusion?
This is a perfusion problem.
Find me an answer.
C.
Okay, but I knew that in the first, once, just with a few things, I knew that answer already, without needing every bit of all the details, okay? This is primarily a perfusion problem. Now, what would I need to do to treat it? Let's say this is a multi-part question where this is the en route scene and post-scene kind of situation. Let's say the follow-up question is, what are you going to do about it? Then what are you going to do about it? So first of all, let's summarize what kind of problem this is. Sick or not sick?
He is sick.
Stable or not stable?
He is unstable.
So let's call this unstable. Is he having symptoms or not having symptoms?
He is having symptoms.
So we call that unstable symptomatic. And is his heart rate fast or slow?
His heart rate is slow.
So that's going to be bradycardia. So unstable symptomatic bradycardia. What's my fix for that?
Transcutaneous pacing.
Boom, just like that. And I'm in and out of that question. And I want to be thinking all of this as I'm reading the question, even though it didn't ask me, because that may be the next question. If I've already thought about it, I'm in and out of that next question. Boom, just like that. Let's go to the next one.